Hello. Our special guest today is Dr. Yael Halaas, who is the president of the American Jewish Medical Association. She's also one of New York City's leading plastic surgeons and is one of the founding board members of Israel Healthcare Highlights. Yael, welcome.
Thank you, Bruce. It's an honor to be part of Israeli Healthcare Highlights and to be with you today.
Terrific. Please tell us how the American Jewish Medical Association, the AJMA, came into being and what it does these days.
Yeah, absolutely. So most people would be surprised to hear that there's never been an American Jewish Medical Association before. When we think of our large United States country, we have so many different ethnicities represented, and all of whom have a medical association. I, for instance, won an award from the American Medical Women's Association when I was a medical student. My parents are South American, so there's a Hispanic medical association in the United States. There's a Catholic medical association. There's Hindu, there's Muslim, there's Indian. And one would think that there would be a Jewish American medical association, but there never has. And that really became apparent, sadly, on October 8th. It's sad to say that it took such an incredibly horrific event to make American Jewish physicians really realize that we haven't been advocating for ourselves, that we don't have a representative body. We don't have a dedicated organization to maintain the strengths between America and Israel, which is of course, Israel's our homeland as a Jewish people. And then we sort of took it for granted. And it's really pretty shocking when we think about some of the worst tragedies amongst the Jewish people. And we've been persecuted a lot. But one of in recent history, the most traumatic event before October 7th was the Holocaust. And when we look at the Holocaust, there are many unique features about it, but one of the most unique features and the most deadly features is that it was the first physician-led genocide. Most people do not remember that the Holocaust really started with nurses and doctors joining and in greater numbers than any other professions. It was the doctors and nurses who carried out the initial euthanasias for the undesirables. And it's when you have the tacit agreement or the encouragement of the medical profession dehumanizing a minority population, that's when you can really industrialize death. And in my introduction, I'm already talking about the Holocaust, but we see so many of these issues being brought up again today. We have, since October 7th, medical students who say we should abandon the Hippocratic Oath. We should use our medical skills to push our social ideologies. We have demonization of the Jewish people, demonization of Israel, boycotting, a double standard against Jews in Israel that you don't see against other groups. And all of that became very apparent on October 8th when we had residents saying, bloodthirsty Zionists never worked a day in their life. I don't want to treat Zionist patients. When you have Israeli patients saying that they're not getting attentive care, Jewish patients saying they're not getting the same level of care. Globally, you have doctors and nurses saying that they've killed Jewish patients and want to do so again. Then we really have to have a strong organization to stand up and represent Jewish interests as well as our supporting our ties to Israel. So what started with a WhatsApp group quickly led to me realizing that we didn't have a strong national organization representing us and the bias we're seeing at the medical schools, at academies, in our journals, in our patient rooms. And so led to the foundation in November 6th of the American Jewish Medical Association, and at the same time, the Global Jewish Healthcare Alliance, because the same issues we're seeing in the US, we're seeing globally. We see terribly in the UK, in Australia, Italy, France, South Africa. And it's imperative that we all work in concert. We truly are one people. That's why it's almost comical when they say, well, you're not really from Israel. Well, where are we from? Because we are facing the same issues. We have the same ethno-cultural religious identity as a people. And so we have to unite to work against, unfortunately, a system that doesn't help minorities.
So what does the AJMA do these days?
So the AJMA does a lot, has had to do a lot in just 2 years. And the first thing I really want to talk about is just promoting a happy, strong Jewish identity. It can't always just be anti-Semitism. So some of the most important or some of my most favorite things that we do is an incredibly strong mentorship program for not only Jewish medical students, but for residents, fellows, young physicians, and also now for pre-health. By the way, it's not just medical. It's also, there is no American Jewish Nursing Association, no American Jewish Dental, no American Jewish Veterinarian. So we really have had to become a home for all of these professions. And for all of them now, we do have mentorship, including for our pre-professional students, public health as well, where we are pairing the future leaders of tomorrow with mentors in our field. And that's one of the happiest things that we do, and I think one of the most valuable for young future colleagues. And that also means having chapters. So we have over 40 chapters in almost all states. And those chapters allow for a really warm, inclusive environment for our learners. And for doctors everywhere, and nurses and staff everywhere. So we have events locally. We have most of the hospital organizations having Jewish employee resource groups so that they can have programming, celebrating the Jewish holidays at least 4 times throughout the year, having events. And then a lot of the bulk of our work has been fighting anti-Semitism. And on that front, we have a couple of points that we've had to carry out. And that is curriculum, for instance. None of the medical schools, and indeed nothing in the entire AAMC medical education portal discusses Jews. They have reams of articles promoting education on racism and other ethnic groups, not a single article, anything on anti-Semitism, which is the most prevalent hate crime in the US. So we have a very strong, robust curriculum that is being piloted in major medical systems and will be rolled out hopefully throughout medical and osteopath schools, and then on to public health and nursing schools and social work schools. We have, sadly, an enormous database, which has proved extremely useful for informing HHS, Congress, and the Senate on the state of anti-Semitism in healthcare. So that has been incredibly important, and also shaping policies to help prevent that and to promote a fair working environment without Title VI and Title VII violations for Jewish learners and also for Jewish healthcare providers. We have a very active journal and publication committee, which also pairs internationally with Israel as well, to fight a lot of the really biased research and journal articles that we've seen in some of our largest publications, from the Lancet to the New England Journal of Medicine. And so that requires, we have a very large research department. And all of this, really, I have to say, is done by volunteers and done by people like myself, full-time, hardworking healthcare professionals who are just so completely flabbergasted, disgusted, anxious about the direction that this is going in. Really, kudos. I mean, you're talking with me today, but it really is an enormous amount of genetic counselors, veterinarians, doctors, surgeons, nurses who are all jumping in, volunteer to really make sure that all of these things move forward as we grow, as we need to grow in 2 years. We're doing many other things. We have continuous programming, have events, as I talked about, missions to Israel, and some of the best things and relevant to our conversation is to helping promote strong bonds and ties with Israel. There, not only do we see decrease in admission to Jews in healthcare profession schools, which is another area of investigation, but we're seeing less representation of Israelis. And that continuous bond between Israel and America is not just important for the Jewish people, but so much richness has come out, so much scientific innovation has come out from Israel, the startup nation, the United States, of course. I mean, when you just look at the sheer amount of scientific publications that come out of our two countries, it's astonishing. And you really do need to have that partnership to grow, and so that you can have improved healthcare in both countries and globally with all of the innovations. So partnering with you and making sure that Israelis still have a representation and a place, because we're seeing a lot of Israeli fellows are not getting the positions that they were getting. They're not being represented on our campuses anymore. And that's really a death to innovation. And in healthcare, that actually means death to patients.
Okay, thank you. That's very important. Here's my last question. What can health professionals or healthcare organizations in Israel do to help support the important work of the American Jewish Medical Association?
So we are really stronger together. And one of the goals of AJMA, and we've discussed with a lot of the leading Israeli medical institutions, is to have more cross communication, more cross pollination. When Israeli doctors, researchers, innovators, anything in healthcare are coming to the US, let us know in advance. And this is something that we've been working on, and you and I have partnered on this, so that we can continuously host you in our institutions, so that we can continuously cross pollinate. There's so much innovation coming out of Israel and OBGYN and AI and robotics and rehab, critical care, cardiology, that the more cross-pollination we have, the more that we can improve the care for our patients. So making sure that we have that really organized is incredibly important. AJMA has been working, has a close relationship with the Israel Ministry of Health. We recently partnered with a group that you know, Bruce, to host the Israeli Minister of Health and the Israeli Minister of Mental Health, so that we could discuss improving Israeli healthcare. So we could really understand how the national residency program in the US works to maybe better and import that in Israel. So that continuous cross-pollination is going to, and lessons learned. And that's really why most true intellectuals and professors and academicians really disagree with any kind of academic boycotts, because we are literally delaying the progress of the free exchange of ideas and knowledge to make our world a better place.
Yael, this has been very informative, very important. Thank you so much for joining us.
Thank you, Bruce. Thank you for having me.